welcome to the staff and the faculty and the postdocs, and I see some visitors, and to the students, and especially the 350 undergraduate students who are taking this event series as a course. I'm Ran Abramitsky, an econ professor and a senior associate dean for the social sciences. And over the next 10 weeks, I will be having conversations with some of Stanford's own Nobel laureates and MacArthur Genius Fellows. And we will try to cover a wide range of fields: biology and chemistry, computer science, economics, linguistics, medicine, physics, sociology, many fields. And we will, of course, talk about their ideas. They are interesting, but I will also ask them about moments of frustration and about research projects maybe that failed, and their advice to young students who are interested in pursuing this kind of career. And of course, I will leave at the end time of each, at the end of each conversation, I will leave enough time for Q&A from the audience, from all of you. And really my main goal for this course is to showcase some of what's so incredible at Stanford. And I hope we'll get inspired by big ideas. And I want to showcase some of our amazing faculty. And of course, my guests are especially inspiring and amazing. But my experience from 20 years at Stanford is that many people at Stanford are amazing and have a fascinating story to tell. So I really hope that the course encourages you to not just study and work all day, but to also connect and to have meaningful conversations with one another and with other people around Stanford and with the people you meet here over the next few years. And so my guest today is my friend and colleague, Al Roth. Al is the Craig and Susan McCobb Professor of Economics at Stanford. And he works in the areas of game theory, experimental economics, and market design. Now, Professor Roth is one of the early pioneers of experimental economics, and honestly, in my book, he should have got the Nobel Prize on his work in that field as well. His research really expanded economic experiments to appeal to other social sciences and to test predictions of bargaining theory and to augment the work of practical market design. And Al has really taken seriously the idea of taking theory to practice. He helped redesign numerous institutions, including the matching of organ donors with patients in kidney exchange, the matching of students to schools in New York City and in Boston, and the matching of medical residents to hospitals. Al has received the 2012 Nobel Prize in Economics for his theory of stable allocations and the practice of market design. He's also an Alfred Sloan Fellow, a Guggenheim Fellow, a Fellow of the American Academy of Arts and Sciences, and a member of the Econometric Society. So thank you very much, Al, for being with us today.
It was a long journey, but worth it.
Yes. So I like to think that we economists save lives, but I find it hard to convince my friends that that's actually the case. But you literally save lives without the algorithm you developed that allows for kidney exchanges. Thousands of people who are walking around today with a new kidney would be dead or would still be suffering on dialysis. And so could you tell us what problem your algorithm was trying to solve, and maybe explain a little bit what exactly is kidney exchange?
Okay, so kidney disease is one of the top 10 causes of death in the US and around the world. And the treatment of choice is transplantation. But we can keep people alive for a while on dialysis, but that's not the same as a cure. And kidneys are unusual because healthy people have two and can remain healthy with one. So it's possible to get a kidney donation, not just from a dead person, which is where we get donor hearts from, but also from a living person. So someone might love you enough to give you a kidney if you needed one. But it's not so simple. Someone could love you enough to give you a kidney, but you wouldn't be able to take their kidney. Even if they're healthy enough to give someone a kidney, they might not be able to give it to you. So sometimes there are these incompatible patient-donor pairs. There's someone who loves you and wants to give you a kidney, but they can't give it to you. And there might be someone who loves me and wants to give me a kidney, but can't give it to me. But maybe my intended donor could give you a kidney, and your intended donor could give me a kidney. And if we can arrange those exchanges, which is things that economists do, we could get more living donor transplants and save more lives.
This is great. So this is fabulous, but you always tell me that you didn't solve the entire problem. So you like to tell me that there is still much more work to be done, and there are still dozens of thousands of people on dialysis waiting for a transplant. So what do you think we can do better?
Well, we can do lots of things better, and in the future we'll be able to do more things better. So in the far future, we're not going to need to do transplants because your grandchildren and mine will regard that as a barbaric relic of the past. They'll say to you, Grandpa, tell me again, we really used to cut organs out of dead people and transplant them into sick people, and we'll have to say to them, yeah, and we were proud we could do that. And, I hope that by the time your grandchildren are grown, we can help sick people grow new kidneys the way we grew our first ones. Or maybe we'll be able to use pig kidneys. We're starting to see that in the news. But everyone who needs a kidney today will either have been transplanted by then or will have died. So we have a responsibility to take care of the people who need kidneys now, and there aren't enough. In rich countries, the reason there aren't more transplants is there aren't more transplantable organs. So we have to think about how to create more exchanges. And for instance, I talked to you about exchange between two pairs, but of course, economists know that barter is difficult because it's hard to have the double coincidence of wants, to find a pair who needs what you have and who has what you need. But when we can look at bigger exchanges and sometimes chains, we can get more exchanges. And if we could erase national boundaries, we could get more exchanges still. So one exciting thing that happened 2 summers ago now is I went to the UAE for the first kidney exchange between the United Arab Emirates and Israel, where both of them have populations of 10 million. That's not big enough for hard to match kidney patients to get matched. But together they were able to transplant pairs from the UAE and from Israel who could save each other's lives.
Yeah, you also mentioned to me at some point that you think that it's not necessarily a bad idea to introduce payment and money for these kind of markets. Can you talk a bit about that?
Yeah. So quite often economists have good ideas that not everyone thinks is a good idea. And this is one of them. A lot of people think that it's a bad idea to offer payment for, say, living donors to give kidneys. And what they're worried about is that poor people would be somehow coerced and exploited. And that's not a terrible thing to worry about. I mean, that's a real thing to worry about. On the other hand, it's also possible that we could figure out ethical, legal, safe ways to be generous to donors that would create more donors and would save a lot of lives. So those are ideas that are in conflict with each other a little bit, and it's a very difficult problem. One of the things I'm now studying because of this is what I call repugnant transactions. And repugnant transactions are transactions that some people would like to engage in and other people think shouldn't be allowed. And so paying kidney donors is this kind of repugnant transaction. It's illegal everywhere in the world except the Islamic Republic of Iran, where there's a legal monetary market for kidneys. Doesn't work perfectly there, but it certainly isn't working perfectly elsewhere. And there are black markets around the world where you can buy kidneys, and those work very badly because they're run by criminals, not through standard medical institutions. So there's lots of things to think about. And in different places, people have different ideas about this. For instance, in the US, here in California, surrogacy, commercial surrogacy, has always been legal. You can have a baby in California where you and your partner, if you're equipped to do it, you can contribute the egg and the sperm, but someone else bears the baby, and the California birth certificate lists you as the parents on the California certificate. Whereas in Western Europe, they think that that's like selling a kidney, that's subject to exploitation. So, but of course, making surrogacy illegal in Western Europe doesn't stop couples that need surrogacy from coming to California and having surrogates. And then there's the question of, can they repatriate the children? So trying to stop people from doing things that they want to do doesn't always stop them.
Yep, and let me see that I understand the solution, if you don't mind to drill a bit more deeply into this. So your solution involves basically the state or the government paying, like, I don't know, I think you mentioned at some point around like $100,000 to people who donate a kidney, and as a way of kind of saying a huge thank you for people who are doing, one of the most altruistic things that one can do. But the idea is that then the government would distribute the kidney based on needs, the way that it's going now, and definitely not based on wealth,
right,
for example.
Okay.
And so I totally get it that introducing the payment will kind of save many more lives and will save money given the cost of dialysis. But as you mentioned, there are all these, it's a transaction that many people find unacceptable. There are moral issues. Would many poor people who can't pay their bills be incentivized to sell their organ? And so, what are what are your thoughts about how to solve some of these concerns?
Okay, well, so we've talked about that, and you've just referred a little bit to it.
Yeah.
One of the things people find repugnant about the idea of paying for kidneys is that maybe it would turn out that only rich people could have kidneys, and only poor people would sell them. And so if they were direct peer-to-peer sales, poor people might be priced out of the market. And indeed, kidney disease, the propensity of kidney disease is tilted towards poor people, as in many diseases, right? I mean, so anyone can have kidney disease, but many more poor people have kidney disease than rich people. So the solution that's sometimes talked about is that if we're going to change the law that says you can't pay for a kidney, we would change it to say only the federal government may pay for kidneys, and that we'd put in all sorts of informed consent and care and waiting times and all that. And then the kidneys would be allocated the way deceased donor kidneys now are, which are considered to be national resources and are allocated based on medical considerations. So you could certainly, with that kind of design, make sure that poor people could still get kidneys even though donors were being paid. It's very likely that donors would be not as rich as recipients, because already we have lots of jobs that are risky in various ways, and coal miners by and large aren't as wealthy as investment bankers. The people who choose to be coal miners are people whose opportunities weren't as the same as those as the people who chose to be investment bankers. So one thing that might concern you is that by and large kidney donors might have below the median income, and kidney recipients have below the median income too, mostly, but that could be a concern. And right now, it's against the law. The 1984 National Organ Transplant Act says you cannot give valuable consideration for an organ for transplantation. It's a felony.
Yep. With respect to economics, maybe this is one of those things where AI can be helpful. So I read this morning at the Stanford Report about these advances in 3D printing of living tissues, a field known as bioprinting, where that many, may allow the possibilities for fabricating patient-specific human organs like kidneys and livers, and they even mentioned hearts. Wouldn't that be amazing?
That would be amazing, and I hope that one day we won't need to do transplants. We'll be able to produce organs, and it will come. It might come through bioreactors and printing, or it might come through stem cells. In other words, you have kidneys because you grew them from stem cells, and maybe we'll figure out a way to do that again. But right now, we can't do either of those things, and it will take a while. The medicine and biotechnology works on a slower scale than consumer electronics.
Right. So the way I think about you is that you are like an economist engineer. So you identify markets that are not working very well, like the kidney donor market that we just discussed, and then you kind of design the market so that it works better. So one of the other markets that you famously redesigned is the National Residency Program. This is the program that basically matches medical residences to hospitals. Could you tell us a bit about your work on that market?
Okay, so the market for new doctors took its current modern form around 1900. Before that, there were lots of medical degrees, and now there are really only two that allow you to practice medicine in the United States, MDs and DOs. Around the time that the Flexner report made that change, we also started to have internships and residencies that are now necessary for being licensed to practice medicine. So when you graduate with your medical degree, you're not yet a doctor who can practice medicine. You have to have what's called postgraduate medical education, where you work in a hospital under the supervision of licensed and board-certified physicians, and those are interns and residencies. So if you know someone who's graduating from medical school this year, in a couple of months, they will get ready to submit a rank order list to a centralized clearinghouse, and the residency programs will similarly submit a rank order list of the applicants, and then something magical will happen. An algorithm will look at those inputs and produce an output that will be announced on match day, and sometimes you'll see pictures of people jumping up and down and hugging each other on the front page of the New York Times on match day. So the current algorithm is one whose design I directed.
So the algorithm is basically giving you the one school you are going to.
It's giving everyone the one residency that they get.
Yes. How do you make sure that when they submit the ranks, both the hospitals and the residences, that they don't have incentives to kind of misreport and say, oh, I know that I can't get into Harvard, why don't I pretend like I don't want to go there? Stanford. I want to get into Stanford, but I'm worried that I will not be accepted, so I will pretend like I will rank it low. So and that will create inefficiencies. So is your algorithm taking into account trying to solve that inefficiency?
So it does. So there's lots of interesting mathematics that addresses that question. But there are a lot of other institutional details that address it too. Before you submit your rank order list to the match, you have to apply to residencies. And they invite some people, but not everyone, to interviews. And there are a lot of interviews, but if they haven't invited you to interview, they're not going to rank you, so you don't have to rank them. So if you would like to go to Harvard, well, to Massachusetts General Hospital, we're talking about hospitals, and they don't interview, you don't have to list them. And they won't list you, they didn't interview you. And you might have, different people can have different preferences over residencies too. So Stanford Hospital is, of course, a wonderful hospital, but it's not many surgeons' first choice for a surgical residency. And the reason is we don't have enough bullet wounds at Stanford Hospital. You might prefer to go to San Francisco for your surgical residency so that you get more trauma, things like that. So, because it's a training period. But the question of, is it safe to submit your true preferences but that would be a little hard to explain.
Right. Yeah. But from their perspective, there is really no incentives for them to misreport their true preferences, and so then they end up getting the ones that is the highest that they have, subject to the school wanting them to take them, basically.
Well, so that's true, but it skips the fact that it's hard to form your preferences. You need to gather a lot of information about places where you might want to do your postgraduate medical education, and that process is getting congested. So the reason we have these algorithms is because they used to have congestion in the process of offers and acceptances, and doing it, computerizing it, makes that fast and quick, and you don't find yourself getting offers and having to answer them before you learn what other offers might come to you. But instead, today, we're having new problems that have to do with the fact that it's easy to make lots of applications. There's an electronic residency application service, much like the college app for applying to colleges. And what that means is you can apply to lots of places. And what that in turn means is that if some residency program gets an application from you, that's not necessarily a strong signal of interest because it was easy to apply. And so that means that as in many markets, the employers are getting many, many more applications than they can interview, and they have to decide who to interview. So right now we're struggling in that market with the process of relieving congestion in applications and interviews, as we have in the market for new economists.
Exactly. This is fascinating, Al. And so what about the matching of students to schools in Boston and New York? What problem were you trying to solve on that one?
So there, the problem, there were two problems. One was congestion. In New York, we redesigned the high school match, and there were over 90,000 students a year who enter ninth grade in New York City. And they used to have a process that went through paper forms and the mails and making decisions. About 17,000 students would get offered admission to multiple high schools. It would take them time to decide, and they ran out of time before school started in September, and about 30,000 students had to be administratively assigned to schools that they hadn't expressed preferences over. So that was the problem in New York, congestion. It was taking too long to make the offers and acceptances. In Boston, the problem was different. They had a centralized, computerized procedure, but it made it really important for you to get the school you listed as your first choice. So you couldn't tell them what school you really wanted for your child, say, as a first choice. You had to instead think, what's the best school I can get for my kid if I say it's my first choice? Because loosely speaking, if you didn't get your first choice, you were sort of shunted aside and other good schools were filled and you got brought back later when all the good spots had been taken. So in Boston, part of our job was to make it safe to say your first choice, even if it was only a small chance of getting it, that it wouldn't reduce your chance of getting to your second choice if you were rejected by your first choice. Whereas it used to be that if you didn't get your first choice, you missed the chance to get your second choice that you would have had a very good chance if you had said it was your first choice.
Right. And are they still using a version of the algorithm these days?
They're using deferred acceptance still. They're using our algorithm. But they've made other changes. They've made changes in the menu of schools that you're allowed to choose from. They've tried to make it more local.
So your algorithms, when you design them for the market, are typically flexible enough to allow kind of like changes over time and changes in local conditions and things like that?
So they're pretty flexible. In this case, they don't have to be that flexible. The algorithms take as input preference lists, but the school the Boston Public Schools has changed over time what menu you are allowed to choose those schools from, partly because of transportation costs. They were moving children around all over the city, and they decided they didn't want to do that anymore.
Got it. And so so you've been very successful clearly with designing many markets, but surely there are markets out there that are still not working as well as you're hoping. Can you tell us about some of those?
Well, so most markets aren't working as well as they might. So I think about matching markets, right? So the markets we've been talking about are different than commodity markets. They're different than the New York Stock Exchange or the Chicago Board of Trade. And one way in which they're different is in the Chicago Board of Trade, you don't care who you're dealing with. If you want to buy 50,000 bushels or 5,000 bushels of number 2 hard red winter wheat, you don't care who you're buying them from because it's a commodity. They're all the same. If you want to buy shares of Microsoft, you don't care who you're buying it from because they don't have to have taken good care of the shares while they had them, and they don't care who they're selling to. But the markets we're talking about are matching markets. They're markets where you can't just choose what you want, you also have to be chosen. You can't just come to Stanford, you have to be admitted. You can't just get a residency at Massachusetts General Hospital, you have to be hired. You can't just go to the school you want in Boston. So they need other institutions. And there are lots of markets where those institutions aren't working well. One of the big ones is how we're going to deal with human migration, refugee resettlement, for example, right? There's no reason people should be crowding at the border after coming through the Central America on foot to try to come to the United States. That's not the way rich people come to the United States. There's no reason people should be trying to get to Italy by putting their children in a boat and making progress across the Mediterranean. So we're doing, but those are matching markets. It turns out you can't control your borders, so you can't easily control who's inside your country, but neither can you choose where you can go if you're looking for asylum. So we're doing a terrible, terrible job of matching migrants to safe places. And we're going to have to learn to do it better, because if wars continue, if the ice gets warmer and the sea rises, there are going to be lots of migrants in your lifetime. And there's a market that's working very badly.
And are there some ideas that you have about fixing it? Or?
Well, so people talk about this, but the hard problem is figuring out which country people will get asylum in. The relatively easier problem, which is one that some progress is being made now, is once you've granted people asylum, how do you find them housing and a city to live in and things like that? So one of the U.S. refugee resettlement organizations is the HIAS. HIAS. Those initials used to stand for something, and now it's just one of the 6 organizations that the State Department relies on to resettle people. And it used to be that in the U.S. we had the idea that we would resettle refugees thinly across the country, so that they would get the hope was they'd be assimilated invisibly. There would be no pockets of hard to assimilate refugees. But it turns out that once you are granted asylum in the United States, you can get on a Greyhound bus and go anywhere you want. So for instance, we have concentrations of Somali Americans in Minnesota and Maine. And it's not because of the cross-country skiing, it's because there were already random communities, and if you're a Somali American, you would like to be there. So thinly settling people across the country hasn't worked well, and you can see why it wouldn't work well. If you are an immigrant who speaks Mandarin or Spanish, and you come to California, you might be able to find work in say, the building trades, if you're a carpenter or something like that, before you learn to speak English well. Whereas if we sent you to Wyoming, there'd be no jobs for you until you learned English. So it might make sense for people who speak Mandarin or Spanish to come to California.
Right. And in fact, some of what we are finding in our work on immigration is that immigrants are very good at choosing the right place for them to live. So like it's not, like they take into account, like what's the best place for them and their children, what are the places for upward mobility. And so they, if you look at immigration in the United States, it's never been a random spreading evenly of places, but rather immigrants tend to move to places that offer opportunities for them and their children. And so, and that's kind of one of the reasons that allowed the children of immigrants to be, so upwardly mobile. Like because U.S. born tend to be more rooted in place, which is not very surprising. You're born in a certain place. This is where your home is, where your networks are. And so moving to opportunity means moving away from home for you. But immigrants have already revealed that they are willing to move to a new country, and so they choose more wisely places that are good for them. So I guess algorithms. But do you think that could there be an algorithm that is allowing people to choose where they live and at the same time taking into account this demand?
Well, absolutely. This is a little bit what we try to do with school choice algorithms.
Right.
We're asking you what schools would you be interested in. Now, refugees, I mean, you're an expert on immigration, so I don't have to tell you that of course, giving new immigrants a list of cities, they've heard of New York City and San Francisco, but they haven't heard of Cleveland or Atlanta. So they're not necessarily equipped to answer your question, where would you like to live? But they are equipped to answer your question, what languages do you speak? How many children do you have? How old are they? What was your profession? What are your skills? And so one of the things you can now do is you can construct preferences for them. You can start to try to predict how quickly will they get a job? And what the State Department looks at is within 90 days, what's the success rate? That's not necessarily the right measure, but we have people here in political science, for instance, studying that quite a bit and thinking hard about how we should receive immigrants. Now, the hard problem is how we should decide who gets asylum. And right now, the U.S. policy is you spend 2 years in a refugee camp in Turkey being processed by American consular officials, and you might decide that you can't do it and you're going to get in a little boat, and try to cross the Mediterranean. And there's it's because we're doing such a bad job of processing. There's a Somali English poet whose name I forget right now, who has a poem called Home, and it has a line in it something like, nobody puts their children in a boat unless the boat is safer than the land. And so, people are in real distress. They're trying to go someplace. If we don't have an orderly procedure for them to go, they'll find other ways to go. But that's very costly for the world.
Yeah. Could you tell us all about maybe like a moment of frustration you had over your career and how you kind of like dealt with it, and how was your experience?
So, one of the frustrations about being a market designer is sometimes we economists have such good ideas, but people don't just, eat them up for some reason.
Are they good ideas always?
Well, so one of the things is understanding when our good ideas aren't so good, and so one thing, for instance, about working with kidney surgeons is, we initially had some quite ambitious ideas about how you might organize kidney surgery, and our surgical colleagues said to us, it's all very well to talk about exchanges among many pairs, but we can only manage the logistics of doing exchanges among 2 pairs. So tell us how to do exchanges among 2 pairs. And that's how we started in the United States. And after they could exchange between 2 pairs, they figured out how to exchange between 3 pairs. And still today, lots of kidney exchanges get done within hospitals on too small a scale to be efficient, when they should be done nationwide. And we ship kidneys around the country now, but not every hospital is equipped to do this. So often things happen very slowly, just for administrative reasons. In other words, the way we pay for a lot of kidney transplants in the United States is through Medicare. And different regions of the country have different Medicare cost sheets. So some hospitals bill $20,000 for a nephrectomy, taking out a kidney from a donor, and some bill $80,000. And obviously it's hard for hospitals to switch kidneys if they're going to charge each other these very different amounts. So we had to figure out a way to make uniform charges, things like that. So there are lots of frustrations at that level. In other words, it's hard to move things along. And it's hard to explain and to have explained to you. The language that doctors and economists speak is often very different from each other. The way we think about things, similarly school administrators or other kinds of practitioners. And so I would say, often people say to me, it must be so satisfying to design these markets, but I think the primary feeling is one of frustration. In other words, we're never doing enough quickly enough, and it's because we don't understand well enough and they don't understand well enough, and it's a long process.
What led you to do this kind of work in general?
So I got my PhD at Stanford 50 years ago in 1974 in a department that no longer exists, a Department of Operations Research that's sort of been subsumed. It's now, loosely speaking, the Management Science and Engineering Department. And I studied game theory, which was a new thing to study. We didn't have a course in game theory at Stanford. My first course in game theory was taught by Michael Moschler, who was a visiting professor from the Hebrew University in Jerusalem. And game theory was one of these things that seemed like a good idea to economists, but not to anyone else. But over time, we began to develop a mathematics that allowed us to talk about how markets work and how people react to rules, and how rules are sort of the design of markets. Design is not just a verb. Sometimes you get to design something. It's also a noun. Markets have designs. How do they work? And slowly, as game theorists, we began to understand how different designs work differently in different markets. So after I got my PhD, I started to read. I happened to start to hear about the problems facing the market for new doctors, and I started to just study the design as a noun of that market. And over time, I studied it quite a bit and knew something about it and about other markets. And then one day, when I was a professor at the University of Pittsburgh in the 1990s, my phone rang, and on the other end of the phone was the director of the National Resident Matching Program, and they were having problems, and he wanted to know whether I would redesign the market. And I still remember viscerally taking that phone call, because my feeling was sort of, gee, I'm sorry I picked up the phone, because he's asking me to do things which I know are a hard problem. And it used to be enough for me to write papers that said this is a hard problem, because I was a theorist and I would identify why it was a hard problem. but I knew that I had to say yes, and that this hard problem would become my hard problem. So I did, and that changed my professional life. I don't just write about why problems are hard. I have to try to solve them. But that's how I got into it.
So now finally, before I open this up to questions from the audience, what advice would you give like young students interested in economics or market design?
Well, okay, it depends what they want to do. But let me say that the market design, among other things, has in our lifetime opened up possibilities for economists to earn their living in new ways. So when I was young, if you met an economist who worked in industry, almost surely he worked for a bank, and he was a macroeconomist, and his job was to predict interest rates, future interest rates for the bank. But now, Hal Varian is the chief economist at Google. Michael Schwartz is the chief economist at Microsoft. Peter Coles has a high position at Airbnb. These are all market designers, and many of the biggest firms in the world operate markets, right? Google operates a market for ads that goes through searches. Microsoft, through their software and cloud. Amazon through their selling everything retail and cloud. Airbnb operates a market for temporary housing. Uber operates a market for rides. So it turns out market designers can be important people in some of the biggest companies in the world. So that's one thing to think about, is that if you're thinking about where you might work, you might want to be an economist and work for companies that run markets. Now, another thing, and only some people who want to be economists will think about this, is you might want to become a professor of economics. And this isn't just about economics, it's about being a professor. There's one big advantage to being a professor, which if it isn't what turns you on, then maybe you shouldn't be a professor. It's that one of the big privileges we have as professors is we get to schedule our own minds. We get to think about what we want to think about and think about them as long as we want to think about them. Now, there are lots of interesting problems out in the world, and if you go work for Google or for Airbnb, they can also find interesting problems for you to think about, but you can't think about them forever. You have to think about them for 2 weeks and give us a recommendation, and then we'll have another interesting problem for you to think about. So that's a nice life too, but it's a different life than thinking about something as long as you want to think about it until you feel that you're ready to write about it and talk about it and move on to something else. So if you're aiming in that direction, that's one of the things you should think about yourself. In other words, how do you want to schedule your mind? There are plenty of interesting problems out there to solve. They pay better than being a professor. But if you like thinking about what you like to think about, you might want to be a professor.
Well, thank you very much, Al, for this. This is great. Thank you. So the floor is open to questions, and Jenna and Gabriel, thank you so much. We'll kind of like walk around with a microphone, so if you can raise your hand if you have a question.
Hi, Dr. Roth. Thank you for the amazing talk. And my question is, do you see a potential market transformation in the healthcare industry in the next few decades now that new technology in the field of biodesign and AI in healthcare are booming?
Well, so we have there's a saying that a camel is a horse built by committee, and we have a medical system in the United States that's built by committee. It's incrementally been built. Thinking about American healthcare is not at all like thinking about starting from a blank page and building up an American healthcare system. But for sure, computational advances are going to have an effect in healthcare as they do everywhere else. And in particular, a lot of what artificial intelligence does is help you look at lots of data and make predictions. And so I think that lots of decisions are going to, predictions and classifications. So a lot of things that are now done by medical experts, like reading x-rays, are going to be computationally possible. And once you can read x-rays computationally, you can read them at any time of day or night. You don't have to have diagnostic radiologists in Bangalore reading them at night. You can have them read on local computers. And it will, there'll also be lots more data. You know, I'm wearing an Apple Watch, and it can sort of take my heartbeat. So there'll be more and more data that we have about ourselves, about our health. And I think that will improve healthcare. But will we still have a complicated medical system in 30 years? I bet we will, because the 30-year from now system will be built incrementally on the current complicated system. And it's complicated in how we pay for it. It's complicated in how we allocate scarce resources. So I think there are going to be big changes, but that 30 years from now, we'll still be talking about what are the big changes we need in American healthcare, and there'll still be some.
Thank you, Dr. Roth. In one of your books, you wrote about markets unraveling when people find ways to game the system. Have you ran into any similar issues with markets you helped design? And if so, how did you overcome these?
Okay, so that was one of the big problems of the market for residents. So market for residents really started around 1900, and for some years after that, graduates of medical school would look for jobs around the time they graduated. And by around 1930, they were looking for jobs around Christmas of the year they were going to graduate. And by the 1945, they were looking for jobs 2 years before they graduated. And helping them form a centralized clearinghouse helped solve that problem. But the problem of unraveling hasn't gone away. So if you know someone who's graduating from medical school this year, they're about to go through the match. But if you know someone who's graduating from law school this year, and they're going to work for a big law firm, or they're going to clerk for an appellate judge, they have already known that for 2 years. They got that job basically after the summer of the first year of law school. And that's pretty inefficient. That causes lots of information loss to have to plan that far in advance with that little information. If you know someone who's going to work in private equity, they may have just gotten a job. I mean, typically it happens in September or August, just gotten a job as an intern or a starter associate at an investment bank, and then in 48 hours, all the private equity firms hire them for 2 years in the future with exploding offers, things like that. So lots of markets have unraveled. It's a problem whenever you have a lot of people becoming available at the same time and trying to be employed by a small group of similar employers. So it's it's a problem for doctors because everyone who gets a new MD wants to be a resident, almost, and they have to be residents at hospitals, at American hospitals. So the market is well defined on both sides. It's less of a problem for undergraduates graduating from Stanford, although if you want to go into investment banking or management consulting, there's a good chance that undergraduates will know long before they graduate what their opportunities were through summer internships and things like that. So, if you apply to college, Stanford admits some big percentage of its undergraduates through early admission, and that's a form of unraveling, right? And especially binding early decision, binding early admission. There are a bunch of American colleges, selective colleges that require that allow you to apply early to only one place, and basically sign a contract that if admitted, you'll go there. That's a form of unraveling. So unraveling is a pretty widespread phenomenon. It causes more or less problems in some markets than in others.
Firstly, thank you for the extremely engaging lecture.
I see you.
You spoke a lot about schools and how there's been congestion in applying for high schools in New York and Boston. And one of the ways that countries like Australia have solved this, it's like they have these zones where if you have a house in that zone, only you can enroll in the particular high school in that zone. But that creates the potential where certain zones are only accessible to the rich, and that causes a lot of the poorer in society to not be able to access that education. So what do you think a potential solution to that problem could be?
That's how I got into the question of school choice. The issue that you worry about is that people who grow up in poor neighborhoods will be condemned to go to poor schools. I'm using the word poor in 2 different ways now. And that contributes to intergenerational poverty, right? That it's very hard for students who grew up in poor neighborhoods and went to inadequate schools to get admitted to Stanford, because it's hard to be prepared through the poor public school system that you may have gone through to be competitive for Stanford admission. So what you'd like to do is you'd like to be able to have people move around the city so that their fate isn't determined by where they grow up. Because because often schools in poor neighborhoods are poor schools. So that's a complicated problem for a couple of reasons. One of the things that makes it extra complicated in the US is that we fund our schools through local real estate taxes. So it's one thing to be a big city like Boston or San Francisco, and there are rich neighborhoods and poor neighborhoods, and you can move people around because it's one school system. But it's another to be an area like the Bay Area, where Palo Alto has different schools than San Jose or San Francisco, and those schools are funded differently. And if you live in Palo Alto, you live in an area where the schools have a lot of funding, whereas if you live in some other areas, they don't. So it's a problem that we don't have a solution to yet. But in big municipalities, we can sometimes move people out of poor, failing schools into better schools. And that makes the poor schools smaller, which makes them easier to fix, or easier to close, which is a political process that works on a different time scale. But yes, I think that the issue of having local schools, of saying you should go to the school closest to your house, helps perpetuate inequality.
Thank you for your presentation, Dr. Roth. My question
Can't see you.
is more...
Wave your hand around so I can see where you are.
Oh, over
thank
here.
you. Okay.
Yeah. Thanks for your presentation, Dr. Roth. So my question is slightly more general. Earlier in your presentation, you were talking about how a lot of economists have like these great ideas, and the hard part is convincing people and institutions to actually listen, right? So you touched on this a bit earlier, but were there specific actions you took or choices you made that you think better positioned you to have the opportunity to advise these institutions and people?
Well, some of that is, we study things empirically and theoretically, and we learn something, but some of it is practice. So when I started with many colleagues to get involved in helping design school choice system for American cities, what we thought we were doing initially was helping design algorithms. That is, we're going to suggest that you ask people for their preferences, and we will help you process those preferences in a fruitful way. But by the time we got to New Orleans, we knew that we had to say to the city, let us help you design an algorithm and a press package to explain to your public what's going on. And so in New Orleans, before the new school choice system was rolled out, the newspaper at the time, which was called the Times-Picayune, I think it no longer is a New Orleans newspaper, but they were prepared. We met with them, and they were prepared to, in the newspaper, explain pretty well what the new system was going to do, and that helped a lot. And one of the things that taught us to do that was in Boston, when we made a new system, the Boston Public Schools sent out informational material, and there was a page that explained that it was now safe for you to put down your true preferences for where your child should go to school. And on that page, it had a phone number of a Boston Public Schools official who had worked closely with us and who understood everything. And it said, if you have any questions, call him. And he reported to us that he was getting calls, and on the other end of the phone would be a mother who was thinking about school choice for her kindergartner. And she'd say, have I understood correctly? If I understand correctly from this page, it says we can safely report what's our true first choice without any risk that'll cause us to have less chance of getting our second choice if we don't get our first. And he would say, yes, absolutely, you've understood perfectly. And she'd say, the reason I'm asking is the nice ladies at the family information centers aren't saying that. The nice ladies are saying you have to be very careful with your first choice. And that was because the nice ladies were giving information that was valuable last year, but they hadn't been brought up to date on the new system. So one of the things we realized was one way to ease transition was to try to help information flow through the system. It's still hard, but I mean, that's an example of something where we were better at convincing parents in New Orleans than we were the first year at convincing parents in Boston, where they were getting dual messages. I see your hands, but the lady with the microphone has to see them.
So I was wondering, so the real world is often very messy. How do you decide what aspects are important enough to include in your models of markets and which are not worth the tractability to include?
Okay, I'm not sure I heard, but I think what you asked is are there markets that we would have liked to redesign, but they weren't tractable, we weren't able to?
Yes, it's more like when you model or when you decide about aspects of the market, you make a choice to include some elements, and some elements you leave out. How do you decide which ones to leave out and which?
So sometimes you leave out elements that are important, and the practitioners say to you, you know, your model doesn't cover our situation. So when we first started to talk to Boston Public Schools, one of the things, at an early meeting, they said to us, you know, schools are complicated. And I remember, because I thought for a moment I might have ruined the whole opportunity, I said, you mean we can't model the school district as a perfect circle in which the schools are uniformly distributed throughout? And there was a moment of silence, and they realized I just told a joke, and they laughed, and then we could talk again. But that's sort of the issue. So it turns out Boston was divided into districts. There were some rules that had to do with traffic. You couldn't send a child to a school that he hadn't asked for if it involved crossing water, going through a tunnel or crossing a bridge. You know, so when I first heard that, it sounded like vampires. You know, you can't have them cross water. But it had to do with traffic. The bridges and the tunnels are congested at the times when schools start. So you had to know that. You had to be able to incorporate it. So things that you leave out of your models become very important. Kidneys, you know, we've had to learn a lot about kidneys, and my colleague Itai Ashlagi in Management Science and Engineering here has become a real expert in immunology, in understanding what kind of kidneys can be compatible with what kind of patients, because that's a very important thing in deciding who can take which kidneys. And so early on, we could just say to the doctors, you tell us which kidneys are compatible, but as we do more national and even international exchange, we have to be able to figure that out, and he's our local expert. So things that we leave out of the model, if they cause it not to work well, we get told you better put it in.
Hi. Excuse me. Thank you so much for talking to us today. It was super interesting. So I have two questions. My first question is if you have given any thought or have done any work on redesigning the ambulance market in the United States. Incredibly inefficient, especially with the way that like insurance covers certain ambulances, but there are a lot of hidden fees that really catch people off guard. And then my second question is, what are your thoughts on the rise of the gig economy and how that impacts the way that like markets are changing with now people who are relying on Uber or Grubhub, DoorDash, so forth for like consistent income? Do you think that this is an improvement in terms of like markets? Thank you.
Okay, so two questions. The first one is easy to answer. I know nothing about ambulances. I've never studied it. It takes me 10 years to understand anything, so I can't even begin to imagine how I would answer about ambulances because I haven't studied them. But I can well imagine there are matching problems with ambulances, because one thing I have thought a little bit about is assigning operating rooms in hospitals, and that's a tough problem. I imagine ambulances is a tough, complicated problem. I know nothing about it. Now, the gig economy, that's a really interesting question, because, of course, you know, one way we as a society help design markets or partially design them is through regulation. And Uber and Airbnb, to some extent, they were designed by people who wanted to move fast and break things. But now we're starting to see regulation. So New York City is starting to worry about what's it like to have a neighborhood where lots of the houses are Airbnb. And one of the things about a neighborhood with houses, many of which are Airbnb, is You don't need hardware stores. You don't need a place to buy light bulbs. You need restaurants. That's a different kind of neighborhood than you might live in, right? You might live in a neighborhood where there's a hardware store, there's a place to buy toilet paper. But people who are in Airbnbs don't do that. So it changes the city. Paris has been worried about this. So we're starting to see some regulation about who, very recently in New York, about how often can you rent an apartment, how active on the Airbnb market can you be? So that's a kind of interaction. We're seeing in California, and the question is, are people who drive for Uber employees, or are they individual contractors, and how does that affect benefits like health and things like that? So it takes a while for these markets to equilibrate. There was a time where Ubers were lots cheaper than taxis, but prices of Ubers have been going up as we discover that it's expensive to provide transportation on demand. So I think part of the question is part of my answer is not all markets are designed conceptually from the beginning, where you have a blank sheet of paper and you write down everything that's going to happen. Some of them, most markets, in a certain sense, evolve in response to the pressures that come up. So we're seeing that in many of these gig economy markets, which I think is perfectly natural. The markets that last a long time are those that are redesigned successfully as the need arises.
Hi. Thank you so much for being here. You mentioned earlier how you you're starting to study a lot more of like repugnant transactions, repugnancy, and like with kidneys. And I guess I was kind of wondering, how has studying repugnant transactions like changed your own personal view of what should be considered repugnant? And like, where do you kind of draw that line? It's like, we should do this this would make things more efficient, to, I'm sorry, we can't do this anymore. This is repugnant.
Okay, that's a great question. So let me answer in two ways. One is, when I talk to surgeons about repugnance of paying for kidneys, often transplant surgeons are willing. One of the things I ask them is, raise your hands, I say, how many of you would be willing to contemplate, let me do that with you. How many of you would be willing to contemplate, in a carefully regulated way, a market in which we would pay donors, living donors, for kidneys? Raise your hand if you think. Now, keep them up for a moment to look around, and there's a bunch of you who would do it. Now, how about if instead of kidneys, I said hearts? So, of course, that kills the donor, right? A lot of people put their hands down at that point. So we all have some idea of repugnance, and to understand repugnance, it's not enough to understand when you put your hand up and take your hand down. You have to understand when other people put their hand up and take their hand down, because these are social contracts we make with each other. So that's one thing to think about. The other is, you might or might not think it's okay to have a market for kidneys. A monetary market for kidneys is illegal in most places, but there are black markets for kidneys. So sometimes when we ban something, we're designing the black market, right? We have a war on drugs, and more than 40% of our federal prisoners have drug convictions. But there's plenty of drugs, right? I mean, there was a time when marijuana was illegal in California, and it's not anymore. But at that time, I mean, when Ron and I went to school, it was mostly illegal. But if in an audience like this I had said, I bet some of you know someone who knows where I could buy marijuana, I would have just been greeted with laughter. Everyone knew someone who knew where you could buy marijuana when I went to college in the 1960s. But it was illegal. So our war on drugs, we're losing, right? We think it's a terrible idea. No one should buy heroin. It's just a bad transaction. We should make a law against it. But making a law against it doesn't make it go away. So we also have to think, what are our options? We would like there to be no drug addicts, but we're not succeeding very much by the way we're going about it. Maybe we should think about a different way of going about it. Now, it turns out with drugs that not only are we losing the war on drugs, it turns out we don't do so well when we try to surrender either. Drugs like fentanyl kill people too quickly to want them to be maybe even decriminalized, I don't know. But that's certainly the kind of thing you have to think of. Maybe, right, not only do we have a war on drugs that is filling our prisons, but we had more than 100,000 opioid overdose deaths last year in the United States, right? So we're really, really losing the war on drugs. Places like Portugal have decided they're going to treat drug addicts more like patients than like criminals. You can get a diagnosis, you're a drug addict, and start to get prescription drugs. But that hasn't solved their problem. It turns out fentanyl is so dangerous, they still kill lots of people. So just trying to give up and say we're going to make it legal to be addicted and you can get a prescription for fentanyl or for heroin also doesn't solve the problem. So I don't know what to do there. But one thing for sure is we have to be aware that we have to, as economists, we have to think about not just what we want, but also what we can get. And sometimes saying that something is illegal does not make it go away. It just drives it into the hands of criminals.
Hi, thank you for everything so far. You wrote that markets like these that operate entirely without money often solve the double coincidence of wants problems that are solved with money or computer technology. So as computer technology advances as quickly and in as many fields as it is right now, do you think the insertion of such will be viewed as repugnant the way it is with money in kidney situations? Sorry, that didn't make any sense.
So I didn't hear well enough to parse the whole question. I'm sorry, I wear hearing aids and I don't always hear you as clearly as I might. Can you try?
Sorry, to reiterate that, as computer technology is advancing and becoming stronger, do you think that using it to solve situations the way money is supposed to be not used to solve situations in the kidney problems will be viewed as morally repugnant?
So money plays a special role in repugnance, which I don't understand as well as I would like. But there are things like kidney donation, which is widely regarded as repugnant, as banned. If I pay you for your kidney, we've both committed a crime. But if you give me your kidney when I need one, you're a hero. So money does have this special role. There are things that are repugnant whether or not there's money. So in Western Europe, surrogacy is by and large considered repugnant, whether or not it's commercial, whether or not you pay the surrogate. Spain and Germany don't acknowledge the parental rights of the surrogate parents. Whereas in England and Canada, surrogacy is, you can't pay the surrogate, but they acknowledge the parental rights. So in England and Canada, surrogacy is the way kidney donation is in much of the world. You can do it, but you can't pay for it. Now, money in markets is a great market design invention. There was a famous economist named Jevons. What's his first name?
Say the last name again? Was
Jevons.
I'm not sure.
So I forget Jevons' full name, but he wrote about the difficulty of barter. If has to do with the double coincidence of wants. That if when I came to California, I sold a house in Boston for money. I came with the money in my hand to California and I bought a house in California. If you weren't allowed to use money to buy and sell houses, I would have had to try to swap my house with someone who wanted to move in the opposite direction, or like kidney exchange, have a more complicated transaction. So money is a great market design invention. It removes the need for the double coincidence of wants, finding someone who wanted my Boston house when I wanted their California house. And in many cases, money is the thing that makes something repugnant. So computer technology is allowing us to make many more complicated kidney exchanges that maybe in the past could only have been made with money, using money. So by and large, kidney exchange is not repugnant in the United States. We needed an amendment to the National Organ Transplant Act to say that, and the amendment passed in the early 2000s unanimously. Both houses of Congress, there was a time when Congress could do things unanimously, and the Norwood Act was passed without dissent in both the Congress and the Senate. So the same law bodies that make it illegal to sell a kidney said you could exchange kidneys. So, but I don't understand repugnance well enough to predict about other things. I mean, it's something that I think we economists need to understand much better. It's much too important to be left to the philosophers.
We'll have time for 2 more questions. So, I know that.
Hi. My question is, how do you account for the differences in theory and practice? Specifically, how you account for human irrationality in market designs?
You know, there's an old joke that many of you have already heard, which says that in theory, there's no difference between theory and practice, but in practice, there is. So, you know, Dean Abramitsky asked me at the very beginning, how do you make it safe for people to state their true preferences? And we make it safe in a way that we can demonstrate mathematically makes it safe. But convincing people that it's safe involves trust in the system. And one of the things we're learning is how to explain what we do more clearly so that people will believe us. Because indeed, when you look at how people interact with these clever algorithms we build, there's some percentage of people who are interacting not in an optimal way. They haven't understood or they haven't believed. Similarly, with healthcare, we have a lot of problems with trust in the system. There are populations in the United States that with good reason, don't have great trust in the healthcare system, and convincing them that if they're registered to be an organ donor, for example, we'll try to save their lives as hard as we can and only, use their organs when we failed, they're not convinced. And that's one of the reasons why not every American registers to be a deceased organ donor. So those are some of the differences between theory and practice. Is we can do things that if you believe what I tell you would work one way, but if you're distrustful of what I tell you, you might behave differently. And then also there's just questions of knowing your own preferences. Often as economists, we like to say, you already know where you want to work, but in fact you have to gather a lot of information to decide where you want to work, and the market has to help you gather that information. So one of the things we see in school choice is not just that we have to allocate children to schools, we have to give families information about schools so that they can sensibly think about where they want to go, and that's part of the market.
Last question.
Hello, and thank you for Dr. Roth. I noticed that when you were talking about repugnant transactions, you always use the example of life and death, but what about things that don't inherently involve life and death, like prostitution or gambling?
Yep.
How are you saying that we should accept those and mold markets into them?
Not necessarily. I mean, these are social decisions. Let me tell you about a repugnant transaction that you might not know about, but that you've all experienced implicitly. When you go next door to buy lunch, the GSB cafeteria never offers you horse meat. It turns out it's a felony to sell horse meat for human consumption in California. And this comes from a referendum in 1998. And almost as many people voted to make it illegal to sell horse meat in California as voted for Governor Gray Davis that year. And this turns out to be easy to enforce, because if you're a restaurant, you wouldn't sell much horse meat if you didn't put it on your menu, and the health inspectors have no trouble telling if it's on your menu. So you can't buy horse meat in California to eat. Is that a good thing or a bad thing? Well, a lot of Californians voted for it. And the reason is not that no one wants to eat horse meat, it's that some people want to eat horse meat and other people think they shouldn't be allowed to. So that's a social decision. How about gambling? Well, how about alcohol? We had prohibition in the United States. So that's not life and death, but alcoholism is a serious social and medical problem. But we found that black markets for alcohol were too hard to stamp out, so we gave up on prohibition. And it's not that alcohol doesn't have problems today. When alcohol is very legal, there's still alcoholism and drunk driving and stuff like that. But one thing that we did accomplish that you can't do anymore is you can't buy moonshine whiskey from gangsters. They've been outcompeted by the expensive wine stores on El Camino. So we took organized crime out of the sale of alcohol. And we hadn't succeeded in banning alcohol, but we probably have more alcoholism than we did when alcohol was illegal, because it's become easier, cheaper to become an alcoholic. Similarly, gambling. There used to be illegal lotteries. There was a game in New York City where I grew up called The Numbers, and and if you lived in the right neighborhood, I went to Columbia University, which is on the edge of Harlem, and there was a weekly newspaper that came out that didn't have a financial page. It didn't report the stock market. But on its front page, it reported one bit of financial news from the previous day's stock market, and that was the volume on the New York Stock Exchange. And I remember saying, why would anyone want to know the volume on the New York Stock Exchange? And the reason was the last 4 numbers were the daily number. So you could bet on a lottery, and they were showing you that they were choosing the number honestly by just taking the last 4 numbers in the volume, the least significant figures on the New York Stock Exchange. And it was a big business. But then New York State decided that they were going to get into this business, and there's now a New York lottery, and there are Powerball lotteries all around the country now. So we tried to ban gambling of the lottery sort, but it was taken over by crime. And I don't know that that was a particularly invidious form of crime. I don't know that there was particular violence associated with it the way there was with alcohol. But lots of tax dollars were lost that are now used to fund education. So we have repugnant markets that don't involve life and death. Some of them we successfully stamp out, like the market for horse meat in California. Some of them are harder to stamp out, like the market for gambling. Prostitution is one that, prostitution in most of the United States is a misdemeanor. It's illegal everywhere except for a couple of rural counties in Nevada. But we don't try very hard to criminalize either the buyers or the sellers, either the prostitutes or the Johns. Whereas we have terrific penalties for what we consider to be sex crimes, right? I mean, if you're a sex offender, you can't live near a university, all sorts of things. But that's not true if you're a prostitute or a customer of prostitutes. So we've decided to treat prostitution as a misdemeanor, which is probably sensible in the sense that I don't think any place has ever managed to abolish prostitution. We don't necessarily want to fill our prisons with prostitutes and their customers, but it's not life and death. So I think that's right. I think you're quite correct. Repugnant transactions are not just life and death. I just chose some of those as examples.
Thank you so much, Al.
Thank you.